Honestly, I cannot recommend highly enough having a doula, even if you're having a hospital birth with an OBGYN. I had a hospital birth. I wanted interventions. I knew that I was going to have an epidural. It didn't work, but that's not the point. And I also had a doula, and that was so helpful for me. For anyone who doesn't know, a doula is a birth professional who can help with the physical, psychological, emotional aspects of prenatal care, labor, delivery, and postnatal care. They're not medical professionals, but they have a lot of experience with birth, and they can support you through it. So my doula provided prenatal care. She came to our house one day. We talked through all the stages of labor. We kind of talked through like what my birth preferences were. We would have had a second appointment, but baby decided to come early. And then she came to the hospital while I was in labor around when I was like 5 centimeters dilated. She helped me with breathing techniques and pain relief. She provided like counter pressure on my hips and things like that. She showed me different laboring positions with a birthing ball. And then she advocated for me when it was clear that my epidural was not working. So she was the one who asked the nurses if they could get the anesthesiologist to come back. And then she was the one who told the nurses like, she's definitely in transition and ready to give birth to this baby, even though it was only half an hour after I got the epidural and an hour after I'd been measured at 6 centimeters. As much research and preparation that my husband and I did, we wouldn't have known that I had gone into transition and that I was literally ready to start pushing. So when she told the nurses, hey, we need the doctor back in here to measure her again, and the nurses were like, I don't think so, we just measured her at 6, we would have just been like, okay, if you say so. But our doula was like, no, get the doctor in here because I know what's going on here. She's about to have this baby. So she was an incredible advocate for me. And then she was right there with the nurses and my husband coaching me through pushing, which was great because, like I said, my epidural did not work. My doctor was great and my nurses were great, and I loved having my husband and my mom there. But having my doula there also made me feel so comfortable because I knew she was there to just support me. After my baby was born, she helped us get started with breastfeeding, and then she went out and bought food for me and my husband. And overall, I'm just so glad that I had a doula with my hospital birth. And if I have more kids in the future, that's what I would plan to do again. Right, Piccolina?